Dr. Justin coming at you with a brand new case study. So this is the cheerleader. Now, as promised, every new case study is going to have a prognosis with it. However, with this particular patient, I'm only going to give you a partial prognosis. Let me explain. So if you've been around, if you've been watching other case study videos, there was another case study that's very similar to this one. Over a year ago, we did a case study about a patient who described a metal bar sensation across their back. And this patient also described a metal bar the very first time that I saw her. I have her MRI right over here. Her MRI is dated June 14th, 2018. So, C4 to C5, anterior bulging. C5 to C6, anterior bulging plus a central herniation. C6 to C7, she has a central herniation. So, she describes her pain level as a 7 out of 10, 6 to a 7 out of 10. We have done 3 trapeze technique treatments so far, and after her 3rd trapeze technique treatment the other day, she's now describing her pain down to a 4 out of 10, and she's actually not even describing herself in pain anymore. She's describing just discomfort, so we're definitely making progress. What's interesting is that it took these 3 trapeze technique treatments to sort of get down through the layers of muscle and to actually feel that metal bar. That muscle, that area, it's lateral to T2, it's around 6 inches in length, and it's around 3/4 to an inch in diameter. So that's going to require a lot of work. That's why I'm giving a partial prognosis today. Otherwise, we're looking at 10 to 12 treatments to be able to get her pain down to a 0 out of 10 minus the metal bar. So, keep on watching for more cheerleader case study videos. Thanks for watching. Everybody have a great day.